Today we'll talk about something that we see frequently in the proctology clinic, and that is an anal abscess. So an anal abscess or perianal abscess is usually a very superficial lesion, as opposed to perirectal abscess and ischiorectal abscess, which can be much more significantly complex and more difficult to treat. Usually just by physical examination alone, someone who has treated this disorder multiple times can tell whether this is a perianal abscess or an anal abscess, or if it's a more complex kind of disease like a perirectal ischiorectal abscess that could be more difficult to treat. Most of the time when we're treating perianal abscesses, we can treat them successfully by just injecting a little bit of local anesthesia and then draining the perianal abscess through the skin overlying it. Most of the time we don't need to prescribe any antibiotics for treatment of this disorder, as drainage itself will suffice. However, if an individual is immunocompromised, severely diabetic, uncontrolled diabetic, or taking chemotherapy, in those kinds of scenarios, we do recommend a course of antibiotics to prevent sepsis and bacteremia. Most of the time for perianal abscess disease, individuals feel significantly better within an hour of having this treated, and it can be treated just within the office setting itself. Usually the discomfort completely resolves and the disease process completely resolves within a week, but often within 3 to 4 days. And for the most part, follow-up for an individual is on an as-needed basis. If the discomfort worsens over the preceding days, or they get recurrent disease in the area, or there's persistent drainage that does not resolve within a week, then at that point follow-up is definitely recommended, because there may be a more complex underlying etiology, such as a superficial anal fistula, or rarely a more complex fistulous process as well. Again, perianal abscesses are most often superficial, can be treated in the office by drainage, and usually resolve within a few days, and don't require antibiotics or follow-up, as previously stated.